The MRCT Center presents Advancing International Pediatric Clinical Research. Time to Listen, hearing from young people in clinical research, Part 2. The international webinars on February 2nd, 2022, featured the remarks of youth representatives about clinical research. Here are excerpts from adult presentations that directly address the perspective of the young people.
Every time I hear this video, I really am impressed by the wisdom of these kids and how much they have to teach us and help us do a better job at what we're all trying to do.
Themes from adult speakers include power imbalances, the importance of children's opinions, appropriate educational materials, creating a safe space, and understanding the benefit of research.
Was Gianna and McMillan, who very much pointed out in their videos about the power imbalances that they see when they're in hospital, when they're talking to doctors, who they see have a lot of experience. And I think it's up to researchers, it's up to medics to really understand that power imbalance and to work really hard to discuss and to impart information to children and young people and their families in a way that they can fully understand and fully be comfortable in participating in studies.
Like for the question that one of the children had asked was, does my opinion matter in clinical trials? And I think this is something that keeps on coming when you're engaging with children and young adults. Their needs and their challenges and their fears and anxieties are really incorporated in the trials that are being conducted. Their voice matters in that when they voice it out or when they say it out, it is incorporated in coming up with real solutions that will not only take care of their needs, but it will go beyond their personal solutions, but take care of a whole cohort or even across generations. How information is best given. And I see John from Barcelona saying it's visual and it's video. I think we need to take time, or the clinical trials need to invest in material development to make materials that really talk with the learners and the students and the young people, so that it is that the message is at home and everything that they need to learn, it's gotten firsthand from the material that they do receive from the team of the trial process. And in the previous presentation, we talked about creating that safe space for them and bringing up the voice and the influence that they have. What does it look like, a safe space in school? What does it look like for a safe space in a hospital where the trials could be happening? And it has to be taken care of in details, looking at the cultural context that the children are, looking at the various barriers that may exist within the environment that the students are operating or the young people are operating. Then how do we reach them? The last child talked about, how can I help you to do my job? So one thing we need to bring on board is that this process, in as much as one is a patient and the other one is a researcher, it has to be very mutual, that everybody is benefiting, and this has to be very clear. In as much as the patient who is participating is getting maybe some medication, they also need to understand the information that is coming out of it will help the researcher also come up with solutions that will help a bigger population of similar issues. So yeah, how do we work together would be a very key question, and it should also be a key focus for every clinical trial, for every participant to understand, beyond me getting just assistance in terms of medication. How else is it of benefit to myself? How else is it going to be? How transparent is the researcher going to be beyond just providing some interventions to the participants?
Another speaker gave a detailed analysis of how the youth comments directly apply to international research.
Now, briefly, I would like to talk about what we saw in the video and the insightful and eloquent comments from Megan, John, and Sandhya, and really unpack what we saw at the end of the video, the list of summary points, and that is what it means to talk directly to children and accessing the voice of the child, and really what it means to listen to children, and how importantly, how we can support parents and carers. So if we can go to the next slide. As a starting point, we really want to underscore this idea that children are rights holders in the international and national setting. And we often hear the word children's rights, human rights being thrown around a lot in various different contexts. And I want to unpack what that means and why it's important, specifically in the context of clinical research. What we've seen historically is children and other research participants who are deemed incapable of providing informed consent being treated or viewed as non-autonomous beings and categorized as vulnerable. Now, what this means is while they're able to access research, it's in a very restricted way. And the overarching concern is protecting them from the research environment rather than facilitating and enabling their participation in research. In the context of children, it's also quite unique because children legally have been presumed incompetent or incapable of making legal decisions. So at a legal level, in addition to the ethics dimension, children are not seen as being able to provide valid consent or being able to engage in valid decision-making. So between these two dimensions, traditional research ethics and the legal frameworks for consent and competence, we have a confusing situation where it's not entirely clear how or to what extent children should be engaged in decision-making or discussions and research, because the ethical and legal value of the participation is not entirely clear. And in that sense, human rights and the legal framework of human rights might provide a different vantage point to negotiate these two dimensions, ethics and law, traditional ethics and law, in a way that enables children's participation to have a little bit more meaning and value. Reiterating what Megan and Sandhya said, we see this in practical circumstances where children often feel they're not seen in the discussions that take place in the doctor's office. And this again might be a function of simply how we've come to view the role of children through the lens of traditional research ethics and traditional legal frameworks for decision-making. Now, it's important to think about what we mean when we say listening to children and accessing children's voices. What I've brought forward here is a model of engagement or child participation, and it actually is taken from the CRC. So as I said before, the CRC creates a set of obligations. States have to actively do things to enable children to exercise and enjoy their rights. And one of those things is the right to be heard and enabling children to be able to be heard. So what we've heard from Megan, Sandhya, and John is and Megan really pointed this out very vividly, is that there's a big difference between just hearing children and actually listening to them. And part of that is the various different aspects and mechanisms that we have in place to listen to children. And John and Sandhya pointed this out, and John really pointed out the difference he felt because he was on an advisory committee, and to have doctors come and ask his opinion. And Sandhya pointed out how she felt to have her ideas and opinions incorporated. And so what we're really speaking to is not necessarily hearing children, but putting mechanisms in place to enable children's views and perspectives to be incorporated and taken seriously. Now yes. So Laura Lundy and the Queen's University of Belfast have actually created a series of tools, one of which is a checklist. And this allows various stakeholders, researchers, other adults to engage in children in a consistent way, and then to test whether their engagement is actually meaningful, to test whether they're able to meaningfully talk to the child. And so seizing on the four elements, space, voice, audience, influence, we have to ask ourselves, what are the things that we're putting into place to give children a sense of having a safe environment, a sense of having time to be listened to? And Megan drew this out by by telling us how she felt when people actually spoke to her, and she had an opportunity to talk back. So both the space and the interaction. John spoke to us or highlighted the importance of supporting and meeting children at where they are in terms of supporting their capacities to express their views. So in some cases that might be visual forms of communication. In other cases it would be visual aids or different mechanisms or tools to be able to support children and meet them in a way that they're able to understand the medical procedures. And the idea of influence and audience, those are important, and we'll have different approaches depending on whether it's a youth advisory committee, it's a one-on-one discussion, or whether children are feeding into the research cycle at a various other point. But it's important to recognize that there's no one way to engage in children. And while these are tools, they will have to be adapted to both the context and the culture of where the children are being engaged with, and to enable them to express their views. And John really brought this out in talking about how parents really play an integral role in how children understand their information, how they're able to express their views. And understanding the dynamics of the family is both complex, and navigating those dynamics in the framework of laws and ethical regulations is further complex. And this, again, is made all the more difficult with different cultural contexts. There's no quick and short answers in terms of how we engage with parents and family and how we negotiate these various different pieces. But the interesting dimension, the important dimension that rights-based frameworks bring is giving us an avenue to negotiate these different powers and authorities in a way that sees the child's dignity and rights, and sees the child's right to be heard and to be engaged as an individual, as human becomings, as people of tomorrow that need to be protected today. But what Yanis Korsic and others have shown us is that children are people of today, and they have views, they have ideas that are meaningful, important to them and to us. As Megan told us, parents can, or adults can learn a thing or two from children. And really her words of, I think she said this in the video, is one of the most important things we can do, or ways to stand up to the world, is to stand up for yourself first. And to be able to do that, children need to be seen as people today. And so the CRC framework, while it doesn't provide answers, it provides us the ground and the foundation to build upon this idea that children need to be seen and heard in the moment, and to slowly accumulate understanding of how to do that through its framework of engagement and participation. So I'm going to stop there, and I appreciate your patience, and thank you.
Megan, Sandhya, and Jan watched the adult presentations and had some final comments to share.
I think that it's impossible to completely get rid of the power imbalance. It's always there. The doctors and researchers have more experience than the children. It's important to make sure that this doesn't prevent the children from openly expressing their feelings and thoughts about procedures. The child's opinion absolutely matters. Before the trial, I think that children should be allowed access to the input and feedback of other children. And that way they can know that they aren't the only ones that went through the processes, and that other kids may have expressed the same worries and questions about it.
इसमें भी यही है, तो मैम हमें पहले वही देना चाहिए कि लिखा हुआ जो भी आप बोल रहे थे कि हमें खुद पढ़ के, तो मैम हम खुद पढ़ेंगे और हमें अगर समझ नहीं आएगा तो हम अडल्ट से उनसे एडवाइस लेंगे। तो मैम दोनों ही होने चाहिए कि अगर बच्चे को समझ ना आए तो हम अडल्ट से पूछ सके। और मैम दूसरी चीज ये है कि क्या नाम है, दूसरी चीज ये है कि सबका माइंड अलग अलग होता है, किसी को पढ़ के समझ आएगा, किसी को अडल्ट से समझ आ जाएगा।
They should have the veto right. They should be able to choose whether they, I mean, if they don't want adult to participate, even if the parents want them to enroll, if they say that they don't want to, that should be definite. Sometimes they don't even know they can, the different situation, but when you get arrested, that they tell you all your rights, like the same way. They should tell you all the rights you have about expressing yourself and giving your opinion. And because sometimes kids have good ideas, but not the confidence. They don't know they can say their ideas. Many kid groups, like in Barcelona, are appearing around the world. I mean, every day Begoña tells us that a new group has popped up somewhere, but there's not that much connection, that much communication between all these groups, and it would be really useful to help this communication and centralize somehow all these groups and help with the communication.
Thank you all. This is an unbelievably informative session and really starts to let us appreciate how much work we have to do, how much we need to make sure that we stay interconnected and address and continue to address those aspects of not only the practical, ethical, and operational issues, but also the issues of inclusion and figuring out how we can hear and how we can sort of feed back the information in a way that is useful. And that goes for, children, adolescents, younger children, and certainly their parents and caregivers, who often can tell us, much better than anyone what we're getting right and what we're missing. And we need to be open to hearing those lessons.